Well, with the high-stakes battle to reopen the government now over, some in Congress are shifting their focus to the problems of rolling out Obamacare. And that has some calling for Secretary of Health and Human Services Kathleen Sebelius to resign. Chris Van Cleve joins us with the latest on that and efforts to fix these problems plaguing the healthcare websites. Chris?
Well, Allison, word of new problems tonight as two House committees are now investigating the launch of the Affordable Healthcare website that for most people who have tried to use it, well, it simply just doesn't work. Day 18 of major website issues at healthcare.gov, and here comes the blame game.
Enormously frustrated.
Secretary Sebelius has had 3.5 years to launch Obamacare, and she has failed.
There's no question that what has happened with the system for the national plans is something that has to be improved.
For days, the White House has ducked the accountability question.
The accountability the president seeks right now is the accountability that comes from making the system better.
Now the Republican National Committee is calling for Health and Human Services Secretary Kathleen Sebelius to be fired after weeks of glitches, error messages, and requests for patients have stopped users from being able to shop for insurance on healthcare.gov. It's the primary marketplace for people in 34 states, including Virginia, to buy the insurance mandated by Obamacare.
Now, I'll be the first to tell you that the website launch was rockier than we would have liked.
And new issues being reported by insurance companies, saying there are problems with the healthcare applications they're receiving from the problem-plagued website.
There are constant improvements underway so that we are getting people in much more quickly. We have a plan to go back and revisit people who may have had an unsatisfactory experience.
At this point, the government won't release any numbers for how the federal exchange has worked. Now, 16 states and the District of Columbia have their own exchange websites. This afternoon, Maryland reported 2,393 people have enrolled in health care in the first 17 days of the month. 23,141 have set up accounts that have had their eligibility determined so they can essentially buy health care if they want. D.C. reports on Monday. Allison?
Okay.